The 21 million shillings was paid by about 20,000 Kenyans, indicating that Kenyans have begun to understand the value of being in that ecosystem, because there are demonstrable witness statements that have confirmed what SHA is doing to our communities across Kenya. We have allocated sufficient resources to fully fund primary health care, ensuring all registered Kenyans can access primary health care services free, fully paid for by SHA. Public health facilities at level 2, 3, and 4, along with SHA contracted hospitals, should not charge Kenyans, as SHA is settling payments promptly. When I say promptly, every 14th of every month, we settle bills for the month, the previous month, every 14th. So next week, we will be settling all the bills for April. We have done so for March. There are only remaining a few cases where there are issues that needs to be sorted out, either between the facility and SHA, or between the facility and the hospitals. So we will continue to refine the payment model to make sure that we pay for services rendered. I am very proud that many of the county governments initially made a claim that was true, that public facilities were providing the most service, yet they were getting the least payments. The model has significantly changed. If you follow it now, most of the money is now being paid to public facilities, because the public facilities are offering the most services to the public. And this is the model we wanted, so that we pay for service. That is the minimum that we can expect from anybody. And I want to commend public facilities under the management of the county governments for stepping up and providing service, and that is why those facilities are being paid. I want to encourage county governments to ensure that the facilities begin to have management units under the FIF arrangement, so that these facilities, with now resources available, they can be able to provide more service. And they need a bit of supervision, so that the money that is transferred to the facilities is not used for cabro and other things. Is used to buy medicine and to provide service. And I expect that our colleagues, the governors, will step up so that we can work together towards making it much more efficient for Kenyans to have medical care. Recognizing the need for skilled personnel to manage health insurance effectively, I'm informed that the recruitment process within SHA is nearly complete, with a strong focus on securing qualified professionals. As promised, staff from the defunct National Hospital Insurance Fund have been given priority in the process. Those not selected for positions within SHA will be reassigned to other roles within the public service. My assurance is that all Kenyans is that no one will lose their job. We also have embarked on a nationwide initiative to improve the availability of essential medicines in our health facilities, ensuring that Kenyans can access the medication they need at health facilities nearest to them. To support this effort, KEMSA is being repositioned to play a central role in strengthening the medical supply chain. This is part of our broader commitment to lowering healthcare costs and enhancing access to quality care. Again, this is a point where I want to request my colleagues here that we have agreed that the refill rate of 40, less than 50% is not correct. We want to move the refill rate to 100%, and it is possible. So we have provided a facility of 10 billion shillings to KEMSA. And the CEO of KEMSA is here. I want him to confirm we have provided a facility of 10 billion shillings to KEMSA, and they have absolutely no reason today why they cannot supply every commodity that is required by counties. My request to the county governments is we also need to make sure that as KEMSA provides commodities, they are paid. It is the only way, you know. I mean, it's just what it is. You scratch my back, I scratch yours. The lawyers say quid pro quo or something. So we just have to agree that counties have to sign that as we pay their share claims, we will make sure that we pay for the medicines that are being supplied by KEMSA. I think that is the agreement that we have. And good people, we all agree that the biggest quarrel from the public in public health facilities is the Hakuna Dawa thing. Yes. So we must deal with this Hakuna Dawa. And that is the only thing that is still holding us back. Yes. So this Hakuna Dawa thing, we must deal with it. And we now have a framework where citizens can go to our health facilities run by the public sector and find the medicine that they need to be able to take care of their health. So let us work together. I think there are framework agreements that have been proposed between SHA, KEMSA, and the county governments. Let us just find it in that framework so that we can facilitate the availability of drugs and commodities and medicines in our public facilities. Now that we are paying from SHA direct to the facilities, there is every reason why we should make sure that the medicines are available in our facilities. Additionally, the government is leveraging digital technologies to make healthcare delivery paperless and more efficient within the next 6 months. A transformation already underway in 6 counties. We just want to make sure that fraud and treating non-existent people and supplying medicines to non-existent people stops. And technology, good people, is going to help us. So, and the rollout is going on. We are going to work with you. We are already working with 6 counties. We will roll it out. Aden Duale and his team at the ministry will be working with you so that we can make sure that we control that space and make sure that there are no ghost people taking medicine and stealing from us. Let me also say one more thing to congratulate all the counties. We now have a list of all the facilities you want equipment to be supplied. I want to ask the ministry to now focus on making sure that we work with the county governments on the facilities they have recommended so that we can make sure that all the requested equipment are available in the facilities. And then we can move to the next level for the facilities that cannot be placed under the fee-for-first service arrangement. I already made the commitment that we're going to pay 30% for the ones you want to purchase outright, and the counties will pay the balance over a period of time. So again, I want that process to come into force so that we can roll out the full scale of our health facility development. Let me say this. We needed to sort out payment. We needed to sort out commodities. And we needed to sort out equipment. Those are the 3 things that we need to sort out, and we are going to do it collaboratively. As I conclude, let me also say one more thing. I am very happy that now I did instruct the Ministry of Education to work on a framework that will facilitate counties to continue giving bursaries to our students. And the ministry have sat down, they have worked out a framework, and now counties can now participate in matters education by making sure that the very deserving Kenyan young people and students benefit from bursaries, both from the national government and the county government. I want to ask the county governments now, you can now sign the agreements that were initially asked by the Comptroller of Budget, and therefore we can all participate in the education of our children. As we said, the two levels of government are interdependent and we work together. So although education is a national function, but we want the support of the county governments in especially matters to do with bursaries. The same thing, health is devolved, but we want to support the delivery of health facility because ultimately the children belong to Kenya. They don't belong to the national government or the county government. And Kenyans who seek medical attention do not belong to the national government or the county government. They are just Kenyans. And they expect all of us to work together collaboratively so that we can deliver on our collective mandate for the people of Kenya. And to give assurance to my colleagues, the county governors, that I have no intention whatsoever to take over any county government functions. I do not have. My hands are already too full. I have too many things to deal with. I can only play a supportive role in making sure that when counties succeed, Kenya succeeds. As I conclude, I urge all Kenyans to register with SHA. Let us move away from the burden of Harambes and the WhatsApp group fundraisers for medical bills. Together, we are building a sustainable, dignified healthcare system that serves everyone without discrimination. Thank you very much, and I'm very happy to work with you guys on making sure that we detect disease as early as we can by providing the infrastructure for surveillance, and to congratulate all of you for what you're doing in making sure that Kenyans are safe from wherever they are. Thank you very much.